Hello everyone, myself Dr. Dipan Saha. I am a consulting physician from Singapore, and today we will be talking about a widely discussed topic, that is diabetes. The diabetes is a disease which has affected millions in the world, and as you all know, the number of diabetic patients are increasing in India as well as other parts of the world gradually. And we have to know that there are different types of diabetes. There is a type 1 diabetes, type 2 diabetes, as well as gestational diabetes. And if we talk about type 1 diabetes, we have to understand that in type 1 diabetes, there is absolutely deficiency of insulin. That means the body is not producing insulin enough, which can counter your blood sugar level in the blood. Because what insulin does, it helps to transport the glucose which is present in the blood, and it takes the sugar away from the blood and store it into the cell. In type 1 diabetes, if there is absolutely deficiency of insulin, and so obviously the blood sugar of the patient will rise gradually, and usually it is detected early in the life. That is why it is also called juvenile diabetes. And next comes type 2 diabetes, where there is enough insulin in most of the cases, but due to some reason the body is not able to utilize the insulin present in the body, and in this case also the blood sugar level will gradually rise and lead to diabetes. And there is gestational diabetes, where the pregnant patient, they will develop diabetes, but usually after the delivery the diabetes will go away on its own in most of the cases. But in all of these cases, we have different approaches of treatment, and there are different tests which can help us to determine the types of diabetes and also the blood sugar range the patient is having. So we have different tests available in the market, like glycosylated hemoglobin or HbA1c level. We have got fasting blood sugar or FBS level, as well as postprandial blood sugar, which is usually done after taking a meal, usually after 2 hours after taking a meal. So there are different values or criteria according to different bodies, like American Diabetes Association, which clinicians often follow to make a diagnosis of diabetes. And if we see or talk about HbA1c, usually the range between 5.7 to 6.4, it is often termed as pre-diabetes, and anything above 6.5 or 6.5 and above, it is called diabetes. And if we see the result of fasting plasma glucose, if the value is between 110 to 125, it will be termed as pre-diabetes, but anything above 126, that will be called diabetes. And the postprandial blood sugar is often used by the clinician, and it is usually done 2 hours after taking a meal, and the value between 140 to 199, it will be called as impaired glucose tolerance or IGT or pre-diabetes, and anything above that will be termed as diabetes. And we have different approaches for the treatment. We have different oral anti-diabetic drugs as well as insulin. In case of type 2 diabetes, yes, in the beginning we often take help of different oral anti-diabetic drugs. But in case of type 1 diabetes, as we have discussed earlier, because there is absolutely deficiency or no insulin in the body, from the very first day we have to take help of insulin. And that means from outside we have to administer insulin into the body. In case of type 2, there is insulin in the body, but for some reason the insulin is not able to cope up with the rising blood sugar. In that case, we can take help of different oral anti-diabetic drugs which can help us to fight against the diabetes. And for gestational diabetes, apart from HbA1c, fasting plasma glucose or postprandial one, we can get help of another test that is called OGTT or oral glucose tolerance test, when the patient is often asked to take a 75 gram of glucose, and after 1 hour and 2 hours serially, the blood sugar is measured. And there are some certain values to which can help us to make the correct diagnosis of gestational diabetes. And importantly, diabetes has different symptoms, like plenty of symptoms, like increased thirst or increased micturition. If any cut or any wound left untreated, it will take many days to get healed properly. And also patient can complain of unusual fatigue, and also patient can complain of unusual hunger. And apart from them, there are some other symptoms as well, like burning feet, which is from the diabetic neuropathy, and also blurred vision, because if diabetes left untreated, it can affect the retina also. So diabetes is a disease. It can affect the multifactorial part of the body, not only the heart, the kidney, the eyes. Almost all the parts, you name it, can get affected if the diabetes is left untreated. So it is quite important to manage your blood sugar level there so that we can prevent the complications of diabetes. And most importantly, you follow the advice of your doctors and routinely get the test done, and also visit your doctor and the dietitian for proper management and get the blood sugar under control. Thank you.